In terms of what types of patients I see, obviously there's a whole gamut. Being internal medicine, we kind of touch upon all the major medical problems: diabetes, cholesterol, high blood pressure, things like that. I have different varieties of age groups, and everybody, obviously there's usually different problems associated with different ages, but certainly there's young people now that are starting to have some of these medical problems too. The amount of time I spend, I space my patients out adequately so that we have enough time to spend with them. It's not unusual for me to spend over an hour with a patient. And that's for a regular run-of-the-mill visit. That's making, and I always say to my patients when they're leaving now, because I have in the back of my mind that idea, you have 3 problems that we're going to have to talk about next time. I always add to the end of my visit, did we discuss everything you wanted to discuss today, or do you have any other concerns? Which I think is the way it should be. In terms of that, the patients seem really, really happy with it. They have the opportunity to get me when they need me, get in and be seen, and all of their medical problems are in one visit. The nice thing about what I do in my background and training is, being that I was at Jackson, there's a lot of things that I can do that a lot of doctors may be apprehensive to do or send to a specialist. So I try to basically put together what a patient is doing in terms of the other visits with other specialists. And if there's things that I can take on, I'll take on those things. Certainly if they're with a specialist they love, I'm not going to peel them away. But I'll try to take on as much as I can, because nobody wants to be seeing 5 doctors and have 5 different sets of doctors visits and things like that.
So from a primary care standpoint in medicine, I think it's important for our viewing audience to understand primary care is so important because they can quarterback that patient and direct them to where they need to go. Specialists focus on what they focus on specifically. We've got a cardiovascular practice, so cardiology and vascular health is what we deal with. If there's another problem, we've got to send you somewhere else, and we most likely going to send you to a specialist. If a primary care physician is there and adequately trained, there's a lot of that can be done and managed within their practice. So you don't have to go all over the city in order to see a bunch of different specialists. You can actually see your primary care physician, and he or she can take care of you and direct you when they feel that you need to go that way. So most people in this area, especially if you're over the age of 50, you should have a primary care physician. This is vitally important to your medical care. You want somebody like a Dr. Dameron to know what's going on with you long term, and then they can send you to where they feel that you need to go. Most important, main point that I want to take from that.
Thank you.
And then the next thing, yes, preventative testing, diagnostic testing. How does that work?
So I'm very much about prevention. Many of the disease states that we see, that I see on a day-to-day basis, are fully preventable medical problems that have to do with the typical American diet and weight gain and things like that. Certainly, we're becoming more aware as doctors that things like cholesterol, there's a very large genetic component. But there are many things that we can do in terms of lifestyle and exercise, fitness, nutrition, that will definitely affect how these other disease states, if they develop at all, how they're maintained. So it's nice to be able to have the time now to sit with patients and educate them on diet and take the time to actually go through these things. And certainly, there is a place for a specialist. I know my limitations in terms of my training, and when I do refer, I send them, and they have a nice little bow on them, so when they arrive. But the nice thing about being in this kind of model is I find myself able to physically talk to the specialist. So I'll call the specialist with the patient sitting in the room. Or I'll tell,
is vital.
Because as you had mentioned, where the quarterback, I've had instances where no one is talking, in the past with the previous model that I had, where no one's talking to anyone, and
you don't have the time.
The same tests are being ordered, the same studies are being, and
same medications are being prescribed.
Correct. So it's nice to be able to get on the phone, and patients, we do have Dr. Google, but patients don't always understand what the care plan is. It's good to make sure that they not only understand it, but that you verified it with their specialist who put them upon it.
Yeah, I think communication in today's day and age is vital. I don't think that we're seeing enough of it, especially in this area. I don't think that physicians really speak enough. So the fact that you have enough time to do this is a huge benefit to your patients, and absolutely incredible.